Dr. Nina Anderson. I'm the Executive Director of Tova Community Health.
I found out that little Jimmy had the sickle cell trait at about age, he was about maybe a month old actually. The doctor called us back in to have the test done. So we were advised that they were going to do the test. So we brought him into the center and they did the little foot prick. It took me about 15 minutes. And I don't know if we got the results that day or we were called back later, but we got the results basically stating that he had the sickle cell trait. Now that I know my son has the trait, it's important to me because it's important to educate him. So I've told him, explained to him how important it is to, when he meets people, if he's interested in dating at a later age and he wants to get married, that it's important to find out their status. We talk about what's the age status, what's your status. He needs to know what's their sickle cell trait status, because I think it's important for them to know if they decide to have children. That's a discussion that needs to be had, because it's possible that they may produce a child with the full-blown disease. It's really important to communicate with their teachers and their coaches if they're active in sports. To let them know, to look for signs, if they don't know if the child has sickle cell trait, for a child who may be going to the bathroom a lot, or if they are complaining about having pains in their backs or their back of their legs, that's important. At times, I know coaches could be very hard on the players to push, but look for those signs. If a child says they need a break, please allow them that break, because a child with sickle cell trait could possibly collapse on the ground and possibly die. So it's important that, the families communicate and be transparent to share this information. There's nothing to be ashamed about. And also educate your children, if you have a child with the trait, to share that information with their spouse or the person that they're dating before they have children. If they're educated on this, these are all different things that we can do to break the sickle cycle.